All right, folks, and welcome back to my fourth episode or installment in the vlog series that I'm doing related to my blog post, Physician Assistants in Orthopedics, What We Do, and How to Become One. And in this fourth episode, that's what I'm going to address, is the fourth question, how to become one. How do you become a physician assistant in orthopedics? So let's go ahead and dive right in. So for those that have a desire to enter into orthopedics, this is how you do it. Okay, the first part is you have to become a PA, and I'm not going to get too much into that. There's a lot of blogs and posts and everything related to just getting into PA school, but in general, you have to become a physician assistant, and that involves getting accepted into one of the 250 accredited PA programs in this country. And to do that, you have to have a bachelor's level degree. Many people, it's in a healthcare related major, and you also have to have all the prerequisite coursework and all of the shadowing hours and patient care experience hours, which, like I said, that's for either another post that I'll do at a later time or another video series altogether. But most PA programs, once you're accepted, they last for 27 months and involve your didactic and your clinical year. And the clinical year is made up of your core and elective rotations, which they all in all total roughly 2,000 or more patient care experience hours. And then after your successful clinical year and you graduate from your PA program, you have to sit for the Physician Assistant National Certification Exam, better known as the PANCE. And once you get that C behind your name because you passed the PANCE, then you figure out where you want to practice, and you got to get licensed in that state. And after that, it's time to get that job. So how do you get that job? Well, a lot of people ask me, is it possible to get a job in orthopedics as a PA if you have no orthopedic experience? Yes, it is possible. And in some cases, a PA that's fresh out of school that doesn't have any experience, some surgeons or groups actually may prefer that. And you may say, well, how is that? Well, PAs that have been in orthopedics a long time have developed their own routine, their own ways of doing things. And a lot of surgeons and groups don't really like, training or retraining experienced PAs. They don't like to try to teach the old dog new tricks, so to speak. So someone that's a clean slate, they would prefer that, especially if there are older PAs in the group that can help train that young PA. So, yes, it is possible. Now, if it's a position that requires more experience, such as a position that would require more autonomy, like an orthopedic urgent care, then it may be tougher to get that particular job. But there's plenty of jobs out there that do accept new PA graduates. So that being said, there are things that make one more not necessarily suitable, but more appealing to potential employers. And a lot of that can be centered around what the PA did prior to PA school. Is there a previous career that may make that learning curve a lot less? And yes, there is. So when I interview PAs for potential or as potential candidates, one of the first things that I look at is what they did before PA school. If someone was, say, an athletic trainer or a physical therapist or military medic or corpsman or Air Force pararescue jumper, PJ, occupational therapist, those people already get a check beside their name because they have a high level of our existing musculoskeletal knowledge. They may need some fine-tuning, but their learning curve is going to be a lot less. So that is a definite plus. There are a lot of surgeons or groups, especially if they're looking for someone to fill a sports medicine position, may actually look for a candidate that has dual credentials as a PAC and an ATC, athletic trainer that's certified. So a patient, or not a patient, but a PA's prior PA school work career can be very beneficial in getting a job in orthopedics. So another thing that can make you a better candidate for an orthopedic job is doing an orthopedic rotation during your clinical year. Now, I knew of some local programs that had previously had orthopedics as a mandatory rotation, but they have since stopped. And at this moment, I don't know any programs that have orthopedics as a mandatory rotation. If you do, please leave that in the comments. I'd be curious to know. But doing an orthopedic rotation can help you, and that reason is twofold. One is it does give you some orthopedic experience in patient care, but it's still only 3 to 4 weeks, and you're not going to get a ton out of those 3 to 4 weeks. The thing that I think doing an orthopedic rotation has more benefit in is networking. Think of that 3 to 4 week orthopedic rotation as a 3 to 4 week job interview. So you have the opportunity to show what you can do. You show your character. If you are of good character, if you're a hard worker, if you show eagerness to learn, if you can take criticism constructively, then all of those are going to bode well for you. And if you finish up that rotation and that particular group or surgeon does not have a job available, if you do those things that I just mentioned, you're going to create a good impression. And that surgeon or those PAs or that group may know another surgeon or another PA in another group across town or in another city that they need a good PA and they want a young PA. So they could refer you to them. So the networking opportunity of an orthopedic rotation, in my opinion, can be more beneficial than the actual experience gained. So that's my take on orthopedic rotations. I do wish more schools had them as mandatory. And that closes out my video vlog series about my blog article, What PAs Do and How to Become One. So, and in conclusion, becoming a PA in orthopedics can be very rewarding. It can be very challenging also. The duties vary widely, and I think if after hearing this, you still want to pursue orthopedics as a career, it would be a wonderful thing to do, and I hope I can help you do it through this. So with that, I'm going to sign off, and I'll see you for the next question and answer session. See you then.